Hello everyone and welcome to Dr. Carminati's YouTube channel. I'm thrilled you're here today as we dive into a fascinating and vital topic in our tech-driven world. Securing telehealth remote patient monitoring ecosystem, straight from the NIST Special Publication 1830. Whether you're completely new to healthcare technology, a curious patient, or someone who geeks out over cybersecurity, this video will walk you through everything you need to know in a clear, engaging way. I'd love for you to suggest new video ideas in the comments. Share your thoughts, hit that like button if you enjoy this journey, and subscribe to join our community of explorers. Let's dive into this critical subject together. Picture this. You're sitting on your couch, sipping tea, and a tiny device on your wrist quietly tracks your heart rate, sending it straight to your doctor miles away. Or maybe you're managing diabetes with a sensor that beams your blood sugar levels to a clinic without you ever leaving home. This isn't science fiction. It's telehealth remote patient monitoring, or RPM, and it's now transforming healthcare. RPM lets doctors keep tabs on your health in real time using internet-connected devices, making care faster, more accessible, and less stressful. But here's the flip side. Every time that data zips through cyberspace, it's a golden opportunity for hackers to swoop in. Your name, medical history, and even your address are all at risk if the system isn't secure. That's why we're unpacking NIST's groundbreaking guide to locking down RPM today. No prior knowledge needed. I'll break it down step by step so you can grasp it all. Let's start with the basics. What exactly is telehealth RPM? Imagine a wearable fitness tracker that is souped up for medical use. Smartwatches, blood pressure cuffs, or glucose monitors collect your health stats and send them to your healthcare team over the internet. This setup shines for people with chronic illnesses like heart disease or asthma, elderly folks who struggle to travel, or anyone recovering from surgery. During the COVID-19 pandemic, RPM became a superstar, cutting down on hospital visits while keeping patients connected to care. It's convenient, sure, but convenience comes with a catch. Every ping of data is a potential entry point for troublemakers, hackers, scammers, or even glitchy tech. Cybersecurity isn't just about protecting gadgets, it's about safeguarding your health and privacy. NIST's guide, SP 1830, steps in to tackle this head-on. So what's NIST, and why should you care? The National Institute of Standards and Technology is a powerhouse of expertise, working to set standards that keep our digital lives safe. Their RPM guide isn't some dusty textbook. It's a practical, hands-on roadmap for healthcare providers, tech developers, and even patients like you. The mission? Stop cyber threats from turning a life-saving tool into a liability. Think of it like building a fortress around your health data, with NIST as the architect. They don't just dream up ideas, they test them in real-world scenarios to make sure they work. We'll explore how they do it, starting with the risks they're up against. Risks in RPM sound like something out of a spy movie, but they're genuine. First up, data theft. Hackers could snatch your personal info, your diagnosis, your medications, your home address, and sell it or use it to impersonate you. Then there's tampering. Imagine someone altering your device's readings. Say, making your heart rate look normal when it's dangerously high. Your doctor wouldn't know how to act. Another threat is system crashes, where attackers flood the network, cutting off your doctor's access to your data. During a health crisis, that delay could be deadly. NIST doesn't just list these dangers, they identify everyone involved. Patients at home, clinicians in offices, and tech companies running the servers. Each link in this chain could break, so NIST builds a plan to reinforce them all. Here's where the NIST cybersecurity framework comes in. A 5-step game plan that's simpler than it sounds. Step 1. Identify. This means pinpointing what's at risk, like your health data or the RPM device itself. Step 2. Protect. Think strong passwords, encryption, which scrambles your data into unreadable code, and firewalls to block intruders. Step 3. Detect. This is about catching problems fast, like spotting a hacker trying to sneak in or a device acting weird. Step 4. Respond. If trouble hits, this step kicks into gear. Think notifying your doctor or shutting down a compromised device. Step 5. Recover. After an attack, this gets everything back on track, like restoring data from a backup. These steps aren't random. They're a cycle you can apply to anything digital, and NIST tailors them to RPM with precision. Now let's get hands-on. NIST didn't just write a theory, they built a test system to prove their ideas work. Picture a lab where they hooked up real RPM devices, sensors, tablets, and you name it, to a cloud server, mimicking how your data travels from home to hospital. They layered on security tools like a pro chef adding spices. Strong authentication came first. Think of it as a VIP pass, ensuring only your doctor or nurse can log in. Encryption locked down the data in transit. turning it into a secret code no outsider could crack. They even added monitoring software to flag suspicious activity, like someone trying to guess a password. This wasn't a simulation for kicks. It showed healthcare teams exactly how to secure RPM in the wild. But what about you, the patient? NIST knows you're not a tech wizard and shouldn't have to be. Their guide pushes for user-friendly designs. Imagine unboxing your new RPM device. It comes with a step-by-step guide, a helpline for questions, and maybe even a video tutorial. For doctors, NIST suggests dashboards highlighting critical info, like a sudden drop in your oxygen levels, without burying them in tech babble. Security should feel invisible, letting you focus on healing, not troubleshooting. They even consider spotty internet, a reality for many rural folks. Offline modes let your device store data and send it later when the signal's back. It's thoughtful touches like these that make NIST's approach stand out. Let's dig deeper into the threats they tackle. A man-in-the-middle attack is sneaky. Hackers intercept your data mid-journey, reading or tweaking it. NIST fights this with encryption and mutual authentication, where the device and server handshake to confirm each other's identity. Then there's ransomware. Criminals lock your data and demand cash to free it. Hospitals have been hit hard by this, sometimes paying thousands to regain access. NIST's answer? Regular backups, extra copies of your data stashed safely so you're not held hostage. They also tackle denial-of-service attacks, where hackers overload the system to crash it. Firewalls and traffic filters keep the pipeline clear. These fixes sound high-tech, but they're like putting deadbolts on your doors and keeping a spare key with a friend. Flexibility is another strength here. RPM isn't one size fits all. Maybe your system uses a smartphone app, or perhaps it's a wearable with a tiny screen. NIST covers both, plus hybrid setups where data bounces between multiple devices. They even plan for edge cases, like a power outage at home. Battery backups and local storage keep your device humming until the lights come back. For clinics juggling hundreds of patients, NIST suggests scalable servers that grow with demand. This adaptability makes the guide a treasure trove for anyone in the RPM game, from startups to big healthcare networks. Why does this matter to you personally? If you're a patient, a secure RPM system means your privacy stays intact and your care stays uninterrupted. Imagine the relief of knowing your heart monitor can't be hacked. If you're a doctor, it's about trusting the numbers on your screen, no second-guessing tampered data. For tech developers, it's a playbook to build tools that save lives without opening Pandora's box. But zoom out and it's bigger than that. Telehealth is booming. By 2030, millions more will rely on RPM. NIST's work ensures this growth doesn't come at the cost of safety. It's about building a future where technology lifts us up, not lets us down. Collaboration fuels this guide's success. NIST didn't lock themselves in a lab. They partnered with heavy hitters like Microsoft, Intel, and healthcare pros who know the field inside out. Together, they tested every idea, refining it until it clicked. The result? A guide that's not just smart but doable. They even share free goodies, checklists, sample configs, and open source tools on their website. It's like handing out a recipe book for cybersecurity success. This teamwork vibe is inspiring. It shows what happens when experts unite for a cause that touches us all. Let's wrap this up with a real-world lens. Say you're thinking about RPM for yourself or a loved one. Start by asking your doctor, is this system secure? Look for signs like encrypted data or two-factor logins. NIST's fingerprints. If you're a healthcare pro, grab the full SP 1830 report. It's a goldmine of specifics I couldn't squeeze in here. And if you're just curious, explore NIST's site. It's packed with free resources to geek out on. This isn't abstract stuff. It's about your health, your data, and your peace of mind. Thanks for hanging out with me on this deep dive. I'd love to hear from you. Drop a comment with your questions, stories, or video suggestions. Did this spark an idea? Let me know! If you liked it, smash that like button and subscribe so we can keep exploring together. You're part of this channel now, and I can't wait to see you in the next one. Take care.